Hi, I'm Luke Chow, a founder of the Morpheus Clinic for Hypnosis here in Toronto, Canada. Today's video is about the differences between psychotherapy, or talk therapy, and hypnotherapy, or hypnosis. The most visible difference between psychotherapy and hypnotherapy is that in psychotherapy, you, the client, are doing much of the talking. You're the one who's looking inward, you're looking at your feelings, your thoughts, you're looking at your psyche, you're looking at your memories, your past, and you're figuring yourself out with guidance from the therapist. As a result, you're doing a lot of the talking so that the therapist can guide you appropriately. In hypnotherapy, the client doesn't do a lot of talking at all. They might give a few simple responses, but typically, when they're in hypnosis, they won't say more than a few words at a time. So in hypnotherapy, the hypnotherapist does most of the talking. In my sessions, I typically do about 95 to 99% of the talking. And the reason for that is that the model for change is different. In psychotherapy, the model for change is that people change when they gain insight, when they figure themselves out. In hypnotherapy, it's more of a learning model in that people change when they take on, when they embrace different ideas or attitudes. Another difference is that in psychotherapy, you're expected to come up with the answers yourself. And in fact, it's not appropriate for the therapist to be giving you all of the answers and solutions. In hypnotherapy, because the hypnotherapist does most of the talking, we are giving you the answers. Because we're giving you the answers, hypnotherapy has a bit more of a one-size-fits-all programmatic approach, whereas in psychotherapy, often the process and the treatment evolves organically as the therapy progresses. One other difference is that in psychotherapy, most of the work is present and past looking. There's a lot of the talking about your childhood, talking about your relationship with your mother and your father, and not so much about imagining a better future. In hypnotherapy, there's less of the past focus and more of a future focus, under the idea that the future is yet to be written, and that if we make changes in the present, we can then make changes for the future. Another obvious difference is that psychotherapy typically takes place over months or even years. Hypnotherapy typically takes place over weeks or months. Since my practice is in the province of Ontario, there are also a few legal differences between the profession of psychotherapy and the profession of hypnotherapy. In 2007, the Psychotherapy Act was passed, which regulates psychotherapy as a registered health profession. Since then, the College of Registered Psychotherapists of Ontario has been doing work to set guidelines and standards for their members, and psychotherapists in Ontario have to be a member of the college. They're treating hypnotherapy as a distinct and self-regulating profession. So considering that psychotherapists are regulated and hypnotherapists are not, why should you choose hypnotherapists? Psychotherapy, after all, is often covered by workplace benefit insurance plans. Well, earlier I mentioned that in psychotherapy, there's a lot of soul searching, a lot of introspection, and that it usually takes place over months or years. So even if insurance covers part of your sessions, it typically doesn't cover all of your sessions. The shorter course of hypnotherapy usually ends up being less expensive for your out-of-pocket costs compared to psychotherapy. So let's just cut very briefly to Adina, our registered psychotherapist qualifying. She'll introduce herself and then I'll be right back.
Hi, I'm Adina Nistor, and I'm a qualifying member with the College of Registered Psychotherapists of Ontario.
That's Adina. I'm proud to welcome her to the Morpheus team. And just to wrap up, I want to say that these two modalities, psychotherapy and hypnotherapy, are complementary because of the reasons above. Generally speaking, if you're not really sure what you want, or if you have a mental illness or disorder, we highly recommend starting with psychotherapy. Otherwise, hypnotherapy helps you look at the road ahead. Thank you. I'm Luke Chow of the Morpheus Clinic for Hypnosis.